class Vermilion. I am Dr. Miyako and I'll be one of your instructors for psychiatry this semester. Now, as promised, I will upload videos of the answers to the questions and expectations that you have had for psychiatry. So, without further ado, let's get started. I'll be including a list of the requirements and some of the notes of what I'm talking about this afternoon, and hopefully we can get started and have more fun in class as you expected. So J.R. Andrew Ortega asked what the reference book for psychiatry in our class will be for the semester. So this is the book that I would like you to use. Please use the 11th edition because it has incorporated DSM-5 criteria, and I think that it will be updating us on the diagnosis and the conditions, the descriptions of the disorders in psychiatry. So it's also an interesting read, and I hope you like it. Well, it's not a question, but it's a comment and an expectation. So Cedric Antiquina said that he expects to gain meaningful learnings of the human mind done through creative and interactive discussions. Well, generally, when I have class, I usually like to ask a lot of questions. So if we have a live lecture next time, I will be asking you a lot of questions. What's in store will be more of interview sessions with actual patients that I will pre-record and then post as videos that you can read or watch on your downtime. Okay, so there's more of that coming up in this semester, and if you have any suggestions or things that you would like to know that would help you understand psychiatry better, please don't hesitate to let me know. And there's Devi Mandaye Gio, who said that by the end of the course, we would be able to help understand people with different mental needs. So I think as a teacher, that would be my biggest goal. So if there is anything that you would like to know that would be helpful for you in order to understand patients who have psychiatric conditions, please let me know during class, or you can send me an email and I'll answer them one by one like I am doing right now. So hopefully, Devi, you will gain a lot of insight and learning in this class as with everybody else. Up next, there's Jaira Jimena, who said, by the end of this course, I expect to learn the skills in how to develop positive relationships with patients. So I take it that you want to learn how to get rapport with your patients, and I think that is a very essential skill in psychiatry. You see, our patients in psychiatry are not always the type of patients who know what's wrong with them or who can tell their stories easily. So that's why we need to be very patient and thus help build the therapeutic rapport that we need in order to facilitate how we are going to get the answers to the questions that we need. Because in psychiatry, the kinds of questions that you ask will matter in getting the history that you need. There's also one of you who asked, John Patrick Ocampo Chang, who said that I discern to know more if people are just faking things or some of these are actual medical conditions that do exist. So I take it that this expectation is like wanting to determine if somebody really does have a mental health issue or if one is faking the symptoms, which can also happen. Well, in psychiatry, this semester we'll be having a series of interviews where we will know how to diagnose and to treat patients. So the most important thing is to be able to know the diagnosis so that we will know the appropriate treatment. So rest assured, we will be having video clips and interviews of actual patients that we will interview live or pre-recorded, and then we will try to see and discern, pick at the interviews, and then we'll see how we can tell if they're real or not. Lacunia also sent in her question. She said, I'd like to know the answer to the question that people usually ask. When do you see a psychiatrist? Well, the simple enough answer is if you feel some distress in occupational and social functioning and you feel like your usual maneuvers are not helping, or if the symptoms are causing disruptions in your usual day-to-day activities, or if you notice a family member or a friend who is having difficulty functioning, then I think that is when they should see a psychiatrist. In clinical practice, we have patients who are very severe, and that's when they are brought to the hospital or to the emergency room to be examined by a psychiatrist. And there are some who have a deep underlying problem that they would like to get help for, and thus they go see a psychiatrist just to be evaluated. So it's a case-to-case basis, and it depends on the insight of the individual who goes to the psychiatrist for help. The last question sent in is by John Patrick Ocampo Chang. Thank you again. He asked an interesting clinical question. It said, what are the possible causes if a 12-year-old boy gets hallucinations 10% of the time and auditory hallucinations 90% of the time if he has fever and took paracetamol since he was 10? Now, I think this is an important question because there are a lot of overlaps in medical problems and psychiatric problems. However, as psychiatrists, we should always evaluate if the problem is more emergent and of a medical nature, instead of treating it as a problem because of the hallucinations. So when we evaluate a patient, we see first if there are medical conditions that we can treat first, so that if it's a seizure problem or a more emergent infectious problem, then we'll treat that first before we consider anything psychiatric. We're usually the endpoint of the diagnostic team. That being said, I'm looking forward to being your teacher for this semester along with Dr. Arias, and we are open to your questions. Please just shoot us an email if you feel like you need help with some academic stuff in psychiatry, and we'll happily accommodate as much as we possibly can. So thank you, have a good day, and I'll see you guys on Friday again. Thank you.